In the next 2 minutes you will learn exactly why you still have pain months after your knee surgery. Because recovery from surgery might take several months, it's not uncommon for the knee that was replaced to remain uncomfortable. More strain is placed on muscles and joints that have not been utilized in a long time as the intensity of rehabilitation activities rises. Stick to the workout plan that a physical therapist has advised. Though bending and stretching the knee may be painful at first, retraining the body to move normally can aid in rehabilitation. Furthermore, postoperative edema is frequently a significant source of pain for patients. Pain in the knee after surgery might continue anywhere from 6 months to a year, but don't give up hope. Knee replacement surgery, once fully recovered, can assist give long-term pain reduction and better function. Every wound, however, has the potential of infection. Germs can get into the injured area even if the health requirements are the highest. The immune system of your body defends itself against such dangers, although bacteria and viruses can occasionally overcome this defense. This is especially true for people over the age of 65 or those who have a weaker immune system. Persistent discomfort, redness, warmth, and swelling are all common indicators of infection. Any off-color discharge, as well as nasty odors, are other signs of an infection in progress. If you detect any of these symptoms, see your doctor right away. Delay in seeking treatment may allow the infection to spread throughout your body, resulting in a more serious sickness. You'll need to work with a physical therapist after a knee arthroscopy. Rehabilitation helps you to progressively reclaim your knee's function. Physical therapy is essential for regaining strength and mobility in and around the treated knee. The precise workouts you'll require will be determined on the type of knee surgery you have. Failure to complete your PT exercises, or executing them improperly, might cause further discomfort, by overstretching a part of the knee that hasn't fully recovered. Excessive pain indicates that your therapist may need to make changes to your rehabilitation plan. Don't forget to check out the 5-minute ritual that will relieve knee pain by clicking the first link in the description. And subscribe for daily videos helping you relieve your body pain. Thanks for watching.